Sanitize your hands before you begin. Assemble the equipment. You will need a basin, the solution, washcloths, a waterproof covering, and a towel for drying the application site following the procedure. Check the label on the solution container to make sure you have the correct solution as ordered by the physician. Warm the soaking solution by placing the solution container in a basin of warm water. The solution should be warmed to 105 to 110 degrees Fahrenheit, which is 41 to 44 degrees Celsius. Greet your patient and introduce yourself.
Hello.
Identify the patient and explain the procedure.
Please tell me your full name.
Mrs. Sprague has been experiencing pain in her left knee from osteoarthritis. The physician has asked the medical assistant to apply hot compress to Mrs. Sprague's knee for 20 minutes. The medical assistant must also instruct Mrs. Sprague in the procedure for applying a hot compress at home. To prepare for this procedure, fill the basin half full with the warmed solution. Check the temperature of the solution with the bath thermometer to make sure it is between 105 and 110 degrees Fahrenheit. Completely immerse the compress in the solution. Wring the compress to rid it of excess moisture. The compress should be wet but not dripping. Apply it lightly at first to the affected site to allow the patient to gradually become used to the heat. Be sure to ask the patient how the temperature feels. The compress should be as hot as the patient can comfortably tolerate. You may want to cover the compress with a waterproof cover. It helps hold in the heat by preventing cool air currents from coming in contact with the compress. It also reduces the number of times the compress needs to be changed. Place additional compresses in the solution so they are ready to use. Repeat the application of the compress every 2 to 3 minutes for the duration of the time specified by the physician. Be sure to check the patient's skin periodically for signs of an increase or decrease in redness or swelling, and ask the patient if the site is painful. Check the temperature of the solution periodically. Remove cooler fluid and replace it with hot solution if needed. Apply the compress for the proper length of time as designated by the physician. Thoroughly and gently dry the affected part. Sanitize your hands. Review the instruction with the patient for applying the hot compresses at home. Check to make sure the patient understands how to do this. Provide the patient with written instructions to take home. Ask the patient to sign the instruction sheet and witness her signature. Sign the instruction sheet with your name and date. Chart the procedure. Include the date and time, method of heat application, which in this case was a hot compress, location and duration of the application, appearance of the application site, and the patient's reaction. Also chart the verbal and written instructions you provided to the patient for applying hot compresses at home. Make a copy of the instruction sheet to give to the patient. File the original in the patient's chart. Properly care for the equipment and return it to its storage location.